Can you actually elaborate on your current position and what you're working on at the moment?
So the last 4 years have been very busy writing a book about dementia, which is, although based on absolute science, was intended for the public. So I had to do a bit of translating and a bit of bringing it to a level without watering down the science, bringing it to a level where the man and woman in the street can understand, because I had become convinced that dementia is the next major challenge for society. It's called Save Your Mind, 7 Rules to Avoid Dementia. And I'm still a neurologist.
You began your career as an engineer. And right after that, later on, you decided to pursue your career in medicine and research. So transitions, of course, are not easy. So can you describe why you first chose engineering and then you decided to switch directions?
I had a bit of an engineering kind of mind. You know, you see a problem, you want to solve it. I became interested in chemical engineering. And in fact, I worked in the Alberta tar sands at a time when we didn't yet produce it, but we knew that we had oil there, we had wealth there, and it was a matter of how do I get this to market. And so I lived in Fort McMurray for a while we did the experiments to try to bring this thing that the Aboriginal people had known about for a long time. It's dark, it's sticky, it's gooey, and by the way, you can light it on fire. So that was a challenge that I thought was worthwhile. But you know, after a while, when every day you go home and you're black from head to toe, and no matter how many times you shower, you're still greasy and sticky. And I knew that this was going to result in an industry for Canada, but it wasn't necessarily going to be something that's going to help the individual. And so I became somewhat disenchanted with that career choice and decided to, and it wasn't like I woke up one morning and decided, oh, I want to be a doctor. It was a very gradual process. I didn't want to lose my engineering. I went from chemical engineering to teaching high school in Montreal while I'm thinking about what I wanted to do, to then going into biomedical engineering because I still wanted to be an engineer. And in the process of biomedical engineering, I started to take lectures with medical students and discovered that I really was very interested in this.
You really wanted to study stroke, especially when stroke was not, people didn't even know about it, or they weren't even studying about it.
But stroke became very important for me as this catastrophic sudden event that handicapped people and sucked down their families into this turmoil. We confirmed in humans the concepts that were coming to us from the laboratory. Basically, that when a stroke happens, even though it results in a deficit, that deficit to some extent is still reversible for a number of hours afterwards.
You have created the Canadian Stroke Network. Can you elaborate on your role and as well as what the whole overall impact has been?
So the Canadian Stroke Network was about bringing patients, bringing basic scientists with their research in the laboratories, to clinicians, to a very broad spectrum of other activities, all intended to bring the patient to the emergency room to receive this drug in a relatively short period of time. And so it was a massive job. But at the end of the day, don't ever underestimate everybody's drive to do better and to contribute to society. And so the Canadian Stroke Network succeeded. The Canadian healthcare budget saved billions of dollars from the activities of the Canadian Stroke Network.
Can you talk about your experience, like being a researcher and a physician, and then having to interact with government or having to interact with the ministers?
Politics is a very difficult business. It is, those people work extremely hard. Number two, they mean well. They want to do the right things. But they quickly learn that if they don't show success within a short period of time, they may not get reelected. So your challenge as a scientist, as a clinician, as someone who has a project, is to speak to them in their own language, in what is interesting to them. And so it's important to have the vision that you can present to a politician from whom you want some help.
This year you've been even awarded with the Gairdner Award. Congratulations on that. What do you think would be your advice for young scientists these days?
Number one, follow your heart, not your brain. Don't go into something because I'm going to make money at this, or because it's going to make me famous. Do what in your heart you think you want to do. Number two, don't be afraid to change course.